Hi everybody, and welcome to Horizon's third Breastfeeding Facebook Live question and answer. My name's Jillian and I'm a registered nurse and lactation consultant here in Miramichi. We're happy to be here today to offer you some breastfeeding support, answer any questions that you may have at a time when breastfeeding support might look a little bit different than it has.
Bonjour, je m'appelle Kayla, je suis diététiste avec le programme Mango, mais aussi consultante en lactation. Aujourd'hui marque la fin de la semaine nationale de l'allaitement et nous sommes heureuses d'être ici pour discuter avec vous et répondre à vos questions d'allaitement, soit en français ou en anglais.
So please feel free to submit any questions that you might have and might come up as you're watching. Breastfeeding during a global pandemic can certainly pose many challenges, and we're here to try to make things a little bit easier. One thing that parents are often wondering is if they do happen to contract COVID-19, are they still able to breastfeed their baby? The answer to that is yes. Breastfeeding still has many benefits, and although we don't know a whole lot about the virus, there are many things that we don't know. We do know that breastfeeding offers babies best protection.
All right, so let's start with our very first question coming from Mallory. My baby was born at 35 weeks and my plan was to breastfeed, but I'm currently having to supplement him with formula to help him gain weight. My question is, what is the best way to do this so as to not confuse him or hurt our chances of breastfeeding?
So that's a really good question, and congratulations, Mallory, on your new baby. So there are many different ways to supplement, and it might take some trial and error before you find something that works for you and your baby. So first off, we'd encourage you to supplement with other devices than a bottle. So a cup, a spoon, maybe a supplemental nursing system, which is a tube that goes at the breast to help baby get some more calories when they're feeding. Another thing that we really try to recommend is if baby is needing to be supplemented for any reason, you want to maybe bring the baby to the breast, nurse as long as possible, as long as baby's able to, supplement if you need to, and then bring baby back to the breast. So this way they are associating the feeling of fullness and satiety and being happy with breastfeeding. So we do have another question that was submitted in advance, and this one came from Milen. My almost 4-week-old wants to suck all the time. Can I use a soother, and will offering a soother affect my milk supply? And actually this question did come in twice, so it's something that a lot of parents are obviously wondering about.
And it is a question that we get a lot. So first, we want to start by telling you that it's very normal for babies to want to suck all the time. It's their biological need to suck, and it's their way of ensuring that they are going to get fed. So, an instinct, and it's something that's really great, knowing that they're able to do that. And it's not a bad thing to offer a soother or artificial nipples down the road. But to start, we do really recommend getting breastfeeding well established before doing so, just to ensure that the baby has a really good latch so as not to confuse baby or impact that great latch. So that usually happens around the age of 4 to 6 weeks, but remember that every single baby is different. So for your baby it might happen after 6 weeks, and that's okay too. Yeah, and just that way it helps so that it doesn't affect baby's supply and affect baby's latch and mom's supply.
And just maybe to add to that, if you do choose to offer the soother, make sure that you offer it after baby's already had a feed and is nice and full, so it's not taking the place of a feeding. You still want to make sure baby gets their minimum of 8 feeds a day and in 24 hours, so that could be 8, 10, kind of their norm, whatever they decide that is. So the soother comes after that once they're fed.
Good. All right, so we have another question. This question's coming from Karin, and her question is, how do I know the baby's getting enough milk? Should I offer one breast or both breasts? And should I also be off pumping on a regular basis? So that's a loaded question.
Yeah, it certainly is. And there's kind of 3 parts there, so we'll try to break it down. So the first part, how do I know baby's getting enough milk? So a lot of parents wonder this, especially where you can't see the exact volume going in, but you can rest easy and know that baby is getting enough if they're having a good output. So what goes in must come out. And as far as diapers, the first day, it's not that they need a ton, but we kind of go by a minimum of 1 void and 1 stool. And day 2, this is nice and easy to remember. Day 2 is 2 and 2, and this is their minimum. Day 3 is 3 and 3. And once a mother's milk comes in, we like to see at least 6 heavy wet diapers a day and about 3 to 5 stools. So again, that could be much more than that, but that's kind of our minimum to know that baby's getting enough to eat. You can also go by how baby's behaving. So a baby should come off the breast content. As they're feeding, you might notice they go on and they're kind of tense. They might have their little fists all balled up because they're hungry. And throughout the feeding, as they get more of a full belly, their little hands will relax and they're more content, and they can come off kind of in that milk coma that you may have heard someone mention before. And that's just not our only focus, but we also do monitor baby's weights. So it's normal for baby to lose in the first 3 to 5 days after their birth. And they can go down about 7% usually of their birth weight. And after that, you should see a pretty steady climb until they reach their birth weight, which is usually between 10 to 14 days after delivery. And the next part, just remind me.
Yeah, no, that's okay. I can share that one. So the next part was about pumping. So as far as pumping goes, it's really based on what your breastfeeding goal is. So if your goal is to never offer the baby a bottle and only breastfeed at the breast, then you don't necessarily need to be pumping. But if you're concerned about your supply or you want to grow your supply, then pumping is something that can definitely help with that. Or if you'd like to have what we call a little bit of a stash in the freezer for some time away from baby. And you can start pumping as soon as you'd like. The sooner the better. We had a discussion about this, about how when we start pumping later on, it's like adding another feeding, or you're trying to get an already established milk supply to increase. So it can take a little more time to build a supply, where if you're comfortable and you're ready to do that right from the start, then we definitely recommend that it would be a little easier maybe, depending on your goals, of course. Oh, is there anything else?
Yes. So should she offer 1 breast or both? And that is something we also get asked a lot. So babies are very much like us in the sense that sometimes they may be extremely hungry, other times maybe not quite so hungry, so they might just want a snack. I usually say sometimes they want the full meal, 3-course meal, and then dessert. And sometimes they just want a couple minutes of comfort, and that's okay. So because they can't necessarily tell us, it's important to feed on one side. I usually try to burp. They may not always burp, but just to kind of wake them up, maybe a diaper change, offer them the second breast, and whether they take it or not, that's okay. So they might take a couple sucks, they might feed for 10 minutes, they might have like the full meal deal on the second breast as well as the first, and it might vary depending on from day to day or just even feed to feed.
Our next question is an interesting one. So, why is my baby so gassy? Are there any foods that I should avoid while nursing? That's from Jessica.
Okay. So there's a variety of reasons that babies can be gassy. First and foremost, they're brand new, most of them, and their digestive systems are new too. So they're just kind of getting things established. They're learning how to feed. Their digestive systems are just kicking in. Everything is new to them. So that can cause some gas for sure. Another reason, it can be that they're just, they're getting used to breastfeeding and the fast flow sometimes of the milk. They may swallow some air, and that can cause some bubbles in their belly and cause them to be gassy too. And it can also be related to the latch. So sometimes if they're not latched properly, again, they get more air when they're breastfeeding, and that causes some tummy troubles for sure. And another cause of this can be something in mother's diet. So not necessarily that there's something that a specific food that every mom needs to avoid if they're breastfeeding, but there are certain foods, of course, that upset certain babies, and unfortunately it's not anything that you know until baby gets here, and it's kind of like a trial and error type of thing. So that can be another reason that your baby is a little bit gassy too.
I'm trying to think. So those were our questions that were submitted so far. We also have another one here. Is it okay to let my baby continue sucking for comfort after he's done eating?
Absolutely. So this is something, it kind of stems off of one of the questions that we had earlier too. Babies have a biological need to suck, and that is imprinted in them because this is how they ensure that they get fed. So they may suck when they're hungry, but they might suck for comfort too. And there's absolutely no reason that you can't allow your baby to continue sucking after they're fed. You might notice that this is happening. Babies they have their big deep sucks and swallows and their feed, but then towards the end they might be doing what we call non-nutritive sucking, which is when they might do little tiny sucks and not a lot of swallowing. They're just really there for comfort, and that's totally fine as long as you're okay with it. That is very, very normal.
Do you have any other questions there?
Yes. So why am I so thirsty when I feed the baby?
Oh my goodness, that's a great one. And a lot of moms will come to us with this. So right now you're producing a liquid. Human milk takes a lot of hydration to produce, and that would be why you're so thirsty. So we definitely recommend always having a bottle of water close to you when you're nursing, just because that's when you're going to get very thirsty. And it doesn't have to be just water. You can also have milk if that's something you like, or some other liquids. But definitely water is a great way to stay hydrated, and that's why you're thirsty.
Great.
Okay, I'm just checking to see if we've had any questions here. None so far, so please send your questions along. English, French, doesn't matter. We're really excited to answer them.
So how about overfeeding? Can you overfeed a breastfed baby?
Oh my goodness, this is another one that we get. So the beauty of breastfeeding is that baby is in control. So we don't know exactly how much we're giving them, but we want to make sure that as long as they're getting they're wet in their dirty diapers and they're alert and they're growing, then we know that they're getting enough, and they're in control of as much or as little as they drink, and they will come off when they're done. So that's a really good thing. You can't overfeed a breastfed baby, and there's a lot of studies that also show that breastfeeding or a breastfed child has less risk of an elevated weight as the years go on, because they've learned to control those satiety cues right away.
I think a lot of people wonder this because babies eat so frequently, but that is very, very normal, and it's related to the size of their belly and also how quickly breast milk is digested. So their belly is very small. I'm just gonna use some.
Yeah.
So they start off about the size of a cooked chickpea the first day, and then move into about a cherry size. So hopefully you can see this marble. So that's in the first couple days. Around day 5, it's about the size, 4 to 5, it's about the size of a ping pong ball is the size of their belly. And by the end of the first week, it's around the size of an egg. So again, very, very small. So they don't take in a whole ton at each feeding, and their belly empties quickly. So this is why they need to eat very frequently. So again, 8, 10, 12, 13, 14 times a day, that's all normal, and you're not gonna overfeed by nursing your baby.
So we have 2 questions. So a question from Sarah. How does a mama get baby to take a bottle of breast milk when they've only had the breast for 5 months?
Ooh, that's an interesting one.
We've seen that a lot.
Yes, this happens very, very often. So there are some different tricks to try, and I don't know, Sarah, if you've tried, was Sarah?
Sarah,
yes. I don't know if you've tried to offer and maybe haven't been so successful with offering the bottle, or if it's just something that you're looking into. One thing is what we do is called paced bottle feeding. So again, it makes it very much like, maybe you can demonstrate.
Yeah.
So
I don't have a bottle.
no, that's okay. So very much like breastfeeding, baby's still in control. Baby's sitting in an upright position and the bottle is in a horizontal position. So yes, exactly. So the nipple of the bottle is about half full of milk. So baby's not being overfed in the sense that the milk's pouring out and they have no choice but to swallow, but instead they can decide how much they take. Some things that can help are having maybe your partner offer, because if it's you offering and baby's declining the bottle, that can be something that makes things a little easier, having a partner, a grandmother, somebody else be the one to give the bottle. Another thing that I have had success with in the past is giving the baby the bottle when they're not super hungry or hangry, as we'd say. So if they're really hungry and like past due for a feeding, that might not be the ideal time because frustration, and they can be more apt to decline it. So to just try to catch them maybe with their early hunger cues, like putting their hands in their mouth, just turning side to side, taking that as a cue that they're ready to feed and offering it then.
Mm-hmm. We've had some other questions come in, so I'm just going to scroll up, make sure I didn't miss any.
Oh, just one more thing.
Yeah, of course.
Another thing that helps sometimes is having it being freshly expressed breast milk. So have had some babies that have refused milk that's been in the fridge or the freezer, and this doesn't happen all the time, but they may be more likely to take it if it's freshly expressed and body temperature.
Definitely. So I have a question here from Sarah, another Sarah.
Okay.
Any advice for moms who have an increase in stress due to COVID, leading to less milk production? And I think this is a great question, especially with our times. So yes, it's an incredibly stressful time right now, especially depending on where our restrictions are. If our family can visit, you might be a little more stressed that your baby get COVID-19. So I guess, and this one, I think we'll both have some great things to recommend. I think my biggest recommendation is just taking that time, doing skin to skin to help ease your anxiety, and the baby's likely feeling some of that too. So the skin to skin to help increase your milk production, ease your anxiety. Take it easy. Make sure that taking care of yourself and your baby is your priority. Spending time with other members in your household, but not stressing too much about making sure the household chores are done, or being able to do this or that, and just really taking that nice quiet time to ensure that the bonding and you can do lots of skin to skin to increase your milk production. Do you have any other suggestions about?
No, I think that just doing all the things that you mentioned, and also just rest assured that by breastfeeding, you're providing your baby with the best possible chance of immunity to the virus and protection. So just know that you're doing the best thing and take comfort in that.
Mm-hmm. Definitely. So that was Sarah's question, and I did see another one. Okay, wow. This one, and we tend to see a lot of these. So this is from Kelsey, and her question is, my baby is tongue-tied, making her latch more difficult. Do you have any suggestions to help make breastfeeding easier?
Wow, so not sure how old Kelsey, your baby is, or how things are going thus far. Has the tongue tie been diagnosed by a lactation consultant or a doctor or nurse, or who's assessed the tongue tie and its severity? So those are all things to consider. And again, how breastfeeding is going. So if you're having difficulties, absolutely reach out to your local lactation consultant, and they can perhaps refer onward if needed, if there needs to be a tongue tie release done. But it's something that we see very, very often. There are definitely some positions that can make breastfeeding more comfortable, and really optimizing the latch is what that would be our focus right off the bat. So a lot of times, go for it.
Well, I'm thinking I might give it to you because I have the iPad.
Yeah. So
there.
what works for one baby doesn't necessarily work for every mom and baby, but a lot of times the football position can allow baby to still get a deep latch despite the tongue tie. And again, it all depends on how restricted the baby's tongue is, how much the baby can move the tongue, and those are all things that need to be assessed by a professional for sure. So if you're having any nipple pain or pinching, or your nipple is coming out and it's not round anymore, those are all signs baby's latch is not quite right. So you can really try to make sure that your baby has a nice wide open mouth when bringing the baby on. Make sure that baby has space for his or her nose, the throat's open, and you're having your baby nicely supported. And again, when baby lets go, one way to assess how the latch was is to check and see if the nipple is pinched or misshapen at all, and that can be a sign that things need to be worked on with the latch. And again, I would absolutely reach out to your local lactation consultant in whatever community that you're in and just get some professional support there.
Definitely. Okay. This is a great question from someone local. Do babies still need to nurse as often when they're being introduced to solids? So I think that's a fantastic question. And the best way to answer that is remembering that at 6 months when we introduce solids, we call them complementary foods, so complementary to breastfeeding. So in the beginning, when they're just learning to eat, they're going to likely still nurse as frequently. And as time goes on and they start to eat more solids, then they may decrease the frequency of breastfeeding. But remember that every baby is different. So if your baby who's still eating a good amount of solids is still breastfeeding a lot, there's not necessarily anything wrong. It's just that they really enjoy spending time at the breast, and they're getting lots of benefits from that as well.
Absolutely. And do you guys, as a dietitian, do you still use the kind of catchphrase, food before one is just for fun?
So I'm kind of on the fence because yes, nutritionally, for the most part, breast milk is still that main source of nutrition. But at 6 months, we do know that the iron stores of a baby are starting to deplete. And of course, it depends on if mother had good iron stores during pregnancy, if the delivery went well, and to see how baby's iron stores are to start. But we definitely need to start introducing iron at that point. So whether with fortified baby cereal or pureed meats or pieces of meat, just to introduce that. But I'm also of the belief that the act of learning that skill to eat, as fun as it is very essential. So babies definitely do need to be introduced to solids around the age of 6 months, but they're going to learn a lot of very important skills in doing so.
Great.
Yeah.
Okay. You want to come through? Or?
Yes.
Oh, good.
So there's a lot of people watching, a lot of names I know. Hello, everyone. Okay, so this is from Mark. Hi, I'm wondering if you can offer any suggestions on being a supportive partner, particularly in the current climate. So I think that's cool because it's our breastfeeding week theme in New Brunswick.
That's awesome. And
Yeah.
support is so important. And there's many ways. So a lot of families kind of struggle with this, especially if they're not used to breastfeeding. How can they support if they're not feeding the baby? But there's so many ways to support mom and baby other than by feeding. So just being supportive, taking the initiative to learn about breastfeeding so that you can offer your help and support. Any suggestions, it's by participating in education, even when mom goes into the hospital, and kind of being that second set of ears that can listen to the staff and their education that they're providing, so that if there's something that mom might forget, that you can offer your support to her that way. Just doing other things around the house, or even caring for the baby as well. So maybe mom might be the one that needs to feed the baby, but you can change the diapers and if that doesn't sound as appealing, you can definitely just cuddle and just take the baby and bond in other ways than feeding too.
Definitely, and I think where so many people associate that bond with feeding, but I think it's really important for partners for the other parent to be doing skin to skin.
Absolutely, that's a really good point.
So great for baby. But there's bath time. My favorite's always in the middle of the night after you've just spent 20-30 minutes nursing. You're exhausted. You'll probably have to do that again in an hour and a half to 2 hours or longer, depending on how old baby is. Then that's where the support of the partner can be really nice to help soothe the baby back to bed if they're not already sleeping. So that's a really good way and very helpful for mom too.
Great question.
Yeah, that's a really good one. Just gonna scroll through.
I think we have time for one more.
I think so. I don't see any. Who's gonna get their question in on time?
So
We want to talk about, I really like that last question that we got, about how other people can support, especially that was our big theme in New Brunswick. So whether you're an aunt or you're a grandparent, I think it's really important to know, what your family's goals are for feeding. So being aware of what breastfeeding is, being supportive in family settings, not that we're having quite as many now, but being supportive in those settings and knowing that, babies eat very frequently, at least 8 times a day, and often more than that, and that's okay. So being supportive of making mom comfortable so that she can breastfeed wherever we are. That, of course, helping with the chores, bringing meals.
A meal, absolutely.
Oh my goodness. So meals and making sure that, mom has a bottle of water while she's breastfeeding. Even bring the meal right to the couch where she's nursing is really helpful. Moms get really good at eating with one hand.
Yes, those are all really great ways to support the mother. So,
yeah. All right.
So,
do we have
I think
anything
that's
else?
all the time that we have for today. So thank you everybody for tuning in, and happy end of breastfeeding week.
Yeah, thank you so much, and happy breastfeeding week.